Awesome. Well, hi, everybody. There's Damien getting his minutes of fame here. So, hey, for those of you who are out there, I'm Mrs. Verstegen. The kids at school call me Nurse Kathy or Vercat or Mrs. V. And I'm the nurse at Kimberly High School and at J.R. Garrett's Middle School in Kimberly School District, which is up in mid-northwestern or northeastern Wisconsin. So I want to tell you a little bit about myself to get started. And certainly we have a chat box, so if you guys have questions or anything, pop them in there. So on this first page, I have a little information about myself, but the most important thing there is that little box that are quotes to live by. And I'll tell you a little bit more about that as we go along. But I've been an RN in the school nurse setting for 21 years. I started as a labor and delivery nurse and also as a NICU nurse, which is a neonatal intensive care nurse. So working with the little babies that are born too soon or born with some complications. And so that's who I was in the beginning of my nursing career. I also moved from there into home care, working with maternal child, they call it. So moms who were home on bed rest because of complications of their pregnancies, or babies who were being discharged from that NICU, or maybe babies or young children coming out of the pediatric area that were going through cancer treatment. I was their home care nurse. So that was my life before school. Also during that time, I was busy having my own children, and so I started doing camp nursing. So I've been working at summer camps for over 20 years, the Y camps, the Epilepsy Foundation camps for kids with seizure disorders. That's been really awesome. Diabetes and what else? Gosh, just special camps for special kids who have special healthcare needs. And so it's been really wonderful for me, a wonderful experience being a nurse and a career as a nurse, because I've had so many opportunities to learn and to grow as a human being, which is pretty awesome. So I just find such great joy, because if you can have a career and you get to come home every day and you get to say, I made a difference in somebody's life, that's pretty amazing. And I think you guys get that already. Otherwise, you would not be ready campers. You get it. You are probably looking forward to a career in some kind of service area, a fireman, a medical professional, or something like that. Maybe you hadn't even thought about it before camp, but through your camp experience and the amazing people you've learned from here, you're probably thinking more about that kind of stuff. So I have 3 grown children. I have 6 grandchildren and 1 more on the way. I love dogs. You might hear mine barking periodically during this talk. I love being outside. So I love hiking and biking and walking and running and swinging my hammock and reading. And I spend time with my friends scrapbooking. I love being the family historian and telling stories through my scrapbooking, through my photos. So that's me. And I would just say I am humbled and just grateful for the opportunity to talk to you all today. So kids at school, they know I'm passionate. I'm passionate about things that matter to me. In my current position, like I said, I work with middle and high schoolers, so that's grades 7 through 12 and beyond at our school. One of my passions with working with those kiddos is teaching them about making healthy choices for a healthy lifespan, which means really encouraging diminishing their risky behaviors. So no alcohol, no drugs, no tobacco products, no playing with vaping products or trying those things that I think really take away our potential for our future health. So I feel like your future is, what you're doing now is a commitment to your future, and a healthy future is what's going to open doors for you that you can pursue your dreams. So I just think anyone making healthy choices is pretty amazing, especially as a teenager. It's hard for us to make decisions as adults, but as a teenager, it's tough, right? Because of the peer pressure and things like that. So kudos to each one of you who are making great decisions for yourself right now, so you can be amazing as you move on in the years to come. So school nurse, what does a school nurse do? What does my typical day look like? Man, I don't think there's such thing as a typical nurse day, and that's even getting even more so as we are navigating through this journey called COVID. On a typical day, we do drug testing in our high school. So we drug test our athletes, our musicians, our kids who have parking passes at our high school, and our kids that are suspicious because of potential drug use. Maybe they've gotten caught with drugs or caught selling drugs or sharing drugs, or their parents are concerned. We do drug testing at our school because we believe in the health and safety of every student who comes through our doors. And so again, that's kind of why we're involved with Project Adam. But for sure, we're doing drug testing. I take care of first aid at school, injuries, emergency response to seizures, diabetes, cardiac emergencies, anaphylaxis. I write about 900 care plans every year for students with health concerns. I may be working with a student that has a cardiac issue, that has cancer, epilepsy, diabetes, again, tube feedings, suctioning, all kinds of things that you would imagine a nurse would be doing. I provide medication for students in an emergency situation, as well as medication for every day, you know, if they need a medication during the school day. I teach CPR classes, first aid classes, AED instruction to our staff, our coaches, our students. Also emergency medications, I teach that to all of our staff and our students who are new to using or needing medication like that, as well as their peer groups, so they can live independently and safely, you know, when they're out there with their sports and all that kind of stuff. So I may be teaching in a class at any given day, many different classrooms that I go into to talk to students and teach. And I may be teaching our teachers, and again, our coaches, and also our teachers' assistants, our aides that we call parapros in our school district. As a nurse, when I give somebody else instruction, it is called delegation, especially if it's a nursing activity. And so that's a really big responsibility. I've got to make sure that everybody knows what they're doing before I give them the green light and I say, go ahead, you can do that tube feeding when I'm not here, right? So I want to make sure they know what they're doing. So that's a big responsibility that I need to document and make sure of. So I oversee the coordination of our AED program in our school district, and I also am an advisor for our teams regarding AODA concerns. So those are alcohol and other drug concerns, including tobacco. So I run programs for students who are on tobacco products and vaping products and want to quit. And we also do programming for students who just want more information so they can be educated, have knowledge, to have the power to make the right choice. So my days are busy, crazy. It's a perfect job for me because I have a lot of energy, keeps me on my toes wherever I am, and I'm just ready to get up and go depending on what the need is in my school. So one thing I'll say is I'm a constant learner. As you will find out in your life, learning is the constant. So hopefully you will choose a career that you love so you don't have to call it a job, and you will love learning about it every day. So that was the advice I gave my own children, and I would say all three of them are in jobs that they love and will be happy with, you know, for their lifetime. So I think, you know, if you can love your work, that is one of the greatest joys of life. So, and I watched the earlier videos this week, and I know MJ and Kim are on, as well as Jody that spoke to you, as well as some other people that you've heard from already this summer. And I just hope you guys realize like how fortunate you are to have these people at your beck and call through this video, through this virtual camp this year. It's pretty amazing. So these are some amazing people who have amazing knowledge and history in their jobs and in their professions. And so, you know, pick their brains as much as you can this time of camp. So, all right. Because my goal as a nurse is the health and safety of my students, it was really an early and an easy decision to become a part of Project Adam through Children's Wisconsin. I have been our Project Adam coordinator since its inception, I think over 20 years ago. And so I, you know, heard about, we'll hear more about Project Adam as we go through the slides here, but later we'll talk more about the great resource. And I think you are maybe already have been on the website. Have you guys? Thumbs up if you have already been on the website for Project Adam throughout this week. Yeah, Damien, okay. So Yeah, make sure you go there. It's a great resource for you. Lots of great videos. If you haven't watched any of them, we might watch a couple today. And yeah, so how did it all start in Kimberly? Well, we had a husband and wife of parents that donated 10 AEDs to our district over 20 years ago. And my administrator at school gave me this little booklet, and he said, oh, here, this is this new project that's out there with Children's Wisconsin. It was Children's Hospital at the time, and it wasn't even Children's Hospital. In fact, it was this mom and dad who had lost their son, Adam, who you had heard about already this week. And they wrote this little brochure up, and they sent it out to schools. And through that knowledge, we had parents that came forward and said, hey, we want to give you an AED for each one of our schools. And so we got these 10 AEDs. And my administrator said, here, take this on and figure it out and make it happen. What do we have to do? And so that's where it all began. I looked at those AEDs. I had no clue what an AED was. I had no clue how it worked. I had no clue where I should put these things. And so through a lot of just reaching out to our emergency medical professionals in our community, our firemen, our ambulance service, other schools, we started to figure it out. And then when Children's Hospital took it on through the Herma Heart Center, we became more educated, and to where we are right now, where we can say to you, just go to this website and all the information is there so that you can help your own school to become Heart Safe certified, Heart Safe designated. It's a pretty awesome program. So I'm gonna go to my next slide here. So you can kind of tell already if you haven't figured it out. I'm a pretty passionate person. I love my job. I love everything I get to do about it. I love the freedom to be who I believe I should be and what matters. And I'm guided by a lot of principles: respect, responsibility, things like that, commitment. And I look at each one of you that I can see right now and the kids that I can think of in my own school. And this is the story that I try to live by. How many of you have seen this story before? Raise your hand. The story of the starfish. Thumbs up. Anybody? No? Jordan's saying no. So the story of the starfish is basically this little girl, this little boy, it could be anyone, on the beach. And this older man comes walking by and he says, hey, what are you doing? He thinks she's dancing on the beach or something else. And he walks up to her and she's picking up the starfish, right, as the water has gone out, and she's throwing them back into the ocean. And the man is like, don't you get it? Look down this beach. There are miles of beach and thousands of starfish. Why are you wasting your time? You're never going to help them all. And with that, she picked up one more and she threw it back in and she said, yeah, but I made a difference for that one.
No, I can't hear it.
All right, and so I just want you to know that's a story I live by. And you'll see me, if you are a student in my school, I wear this around my neck literally every day. And I have a pair of earrings to match. And I share this story with as many people as I can, because at the end of the day, no matter if you're a sixth grader or a senior or a mom or a dad or a teacher or a coach or whatever your job is, you want to go home and know that you made a difference for that one, you know, and that is going to be the legacy of your life. So just know that. I think that's a really important thing, and it's a story that's really important to me, and maybe it'll be the story that you carry for someday too. So, okay. So if you have questions while we're watching, I'm hoping, or while you're going through this morning or this afternoon with me, I'm hoping MJ will stop me and let me know. And if you're watching this later on the recording and you need something or you have questions, that's my email address. So please feel free to reach out to me. I am available to you, and I just want you to be successful in your walk and whatever your journey is going to look like, you know, through this training, okay? So my question to you right now, and I want you to go up to the chat box and I want you to throw it in there, is what is a leader? What is the first word that comes to mind when I say leader? Go ahead, type it in the chat box. All right. Can someone just shout out? What is the word that you put in there? Unmute yourself and just shout it out.
Caring.
Okay. Sounds good. That's a good one. Yeah.
Damien said kind.
Thank you.
I said mentor others. Jordan says caring. Rayanne says caring. And Ashley says determined.
Awesome. Those are all awesome. Just daring to do all those things. That's wonderful. So when I think about what a leader is to me, a lot of things come to mind, but one is definitely passionate. You know, I think if we are passionate about what we're doing, we are going to be all those things that you guys just said. And I think Kim hit it on the nail on the head the other day when she said leadership does matter. Leaders matter. And when we're passionate, we are going to be caring and all these things that you're writing down and you're thinking that make a great leader, right? Because honestly, we're talking about emergency response here, right? And I think we can all agree that taking the lead in an emergency matters because we're potentially saving someone's life, right? So I believe, like I said earlier, I think you guys all get that already and you have a passion for this kind of thing or an excitement for it, because otherwise you wouldn't be here. So thanks again for being here today and for getting on. All right. And like we said earlier too, yeah, it's not always easy. It's not always easy to be caring, right? Or to be respectful, because we might not agree with that person's ideas, but we got to do our best to make it happen and to get along and to work as a team. Because also in emergencies, teamwork is super important, okay? Teamwork is super important. You may not like the person, but you might be on a team where you got to respond together to an emergency and you're going to make it happen. So keep learning, keep seeking the knowledge of things that you're passionate about so you can be the best you can be, okay? All right, so here we are, our first short video, all righty? And I guess one of the questions I want to answer today is, why is being a heart, safe school, right? Why is that important? So what I want to do is, first of all, let's repeat a couple statistics that you guys heard earlier this week, I think from Jody. Over 300,000 people in the United States every year die of sudden cardiac arrest, okay? Outside of a school, or outside of a school setting, or outside of the hospital setting, I should say, when that happens to someone, their survival rate is pretty low. Does anyone remember the survival rate when we have a heart attack or a cardiac arrest outside of a hospital setting? And MJ, maybe you can tell me what's going in the chat right now. I don't see the chat, sorry.
Just Damien said no.
Okay.
Rayanne says 12.
Yep. So about 10 to 12%. So Rayanne, you're right on, okay? But if we flip that and we take people like me, like each one of you, and we put you in a situation where you have training and you recognize that this emergency is happening and you can take action, like doing hands-on CPR, hands-only compressions, your CPR, get an AED and bring it to that scene, you can increase their rate of survival from that 10 or 12% to like 50, 60, 70% survival rate. That's crazy. And when we watch videos and we read about it or we see it in training like this, it might seem like just a number, but you know, as a medical professional, I know, MJ knows, other people who work in the hospital setting, these numbers represent human beings. They represent our friends, our parents, our grandparents, our neighbors, people that we know, we care about, we love. So these numbers equate to people that get to go home to their families, you know, so that's pretty amazing. And we can say we had a part in that by being on that scene or by teaching someone else about it. So even what you're learning to be able to teach your friends how to do hands-only compressions, you've just taught somebody to potentially save a life. So that's called a ripple maker, right? So let's watch this short video, and I'm going to try to get it to go here. And I tried it this morning and I couldn't get the audio to go for you guys. Let's see what happens. Can you guys hear it?
No, but
I'm not sure how to make the audio go so you guys can hear it, but can you pull it up, MJ, and show it?
yeah, that maybe that'll work. So
Okay.
hold on, it's YouTube.
Cool.
Okay.
You can just put Mini Vinny in there if you want to, CPR.
Mini CPR.
Mm-hmm.
Okay, got it.
Should I stop sharing so we can show that?
Yeah. Hold on a minute. I need to
Alright.
share my screen now. So hold on. All right. Okay, can everyone see it?
Yep.
Okay.
There are times in life when being tough comes in handy. Say some numpty collapses in front of you and your mum or dad ain't around. What do? We need a volunteer that ain't breathing. Here's one I made earlier. First off, check you're not in any danger. Then check him over. If he ain't breathing or making noises like this, then he's having a cardiac arrest. Shout for help. Help! Then call 999. I know, don't panic. The geezer on the end of the phone will tell you what to do. And no kissing. Don't even kiss your nan on the lips. Lock your fingers, knuckles up, and push hard and fast here on the sovereign to the tune of Staying Alive. Push down 5 to 6 centimetres. That's about 3 inches, whatever they are. Push hard and fast, go on. Better a cracked rib than him kicking the bucket. Do this until help arrives.
That's my boy.
Remember, shout for help, call 999, push hard and fast to Staying Alive.
Hands only CPR. It's not as hard as it looks. This is for training purposes only, so don't try it on your mates.
All right, Muppets?
All right. So have any of you ever seen that video before?
I had not.
Oh my gosh, it's hilarious. And there's an adult version of it where Mini Vinny's dad
Essays that
does
inspire,
it as well.
messages
a
that
minute.
forge a brighter
Kind
connection.
of
Sorry
fun.
about that.
Nope, that's okay. So I'm gonna go ahead and start screen sharing again. You guys ready for that? All right. If you want to see more videos like that, there are more. There's like a short series, and some of them talk about rescues, being rescued, you know, saved survivors with an AED. And the only thing about these videos is, of course, they're coming out of Britain, and their emergency number is 999. So what is our emergency number, you guys?
911.
Yes. So just, and I think you all know that, so just be aware. That was a little different, but I like it. It's a little humorous, and so I like it. All right, on this video, I thought, well, now that we kind of know why it's important, and you've heard these statistics more than once about why it's important to be ready, right, in our schools, we want to think now, where do I go from here? How do I get this going? And of course, we'll talk more about Project Adam and about the website. That'll come up, but I always think about, what are the first things to think about, even as a youth or a staff member at a school? You know, you want to talk to the leader in your school. So go into the chat right now and write down, who do you think the leader is in your school that you're going to talk to about this kind of thing that has to happen in your school, to see where your school is at with a program like this. And MJ, can you tell me some responses?
School nurse, Damien says. Jordan says nurse or administrator.
Mhm.
And Rhiannon says my parents and the principal.
Awesome.
Her parents are both teachers at the school.
Very cool. Good. So yeah, those are exactly right. You want to go to the leaders of your school and the people that will get behind the charge, you know, and you don't know. I mean, maybe you're going to get to find out where your school is already at. You know, they might have some things done already and things in place. So here are some things to kind of think about and to be aware of. And these are also on that checklist to become a heart safe school. So training for the staff. Are the staff trained? Are the students trained? There's a state law out in Wisconsin, I know right now, and probably in many other states, that says every school, middle school through high school, at least once through your 7th to 12th grade year, you have to be offered the opportunity to be CPR certified, okay? And to learn about an AED. Awesome. But that's not for every staff member. Not every staff member is mandated to be trained. Many schools just kind of do what they think is best. Maybe they have some barriers that stand in the way from them doing what they think they should do. You know, maybe it's because it's too expensive, or they don't have a school nurse. School nurses are not mandated, so teachers are mandated and counselors are mandated, but school nurses are not in the state of Wisconsin. Other states they are. So, you know, going to your principal, going to your nurse if you have one, things like that, really important, right? To start that conversation. So, but again, training, do they already have an emergency response plan in place? Maybe a school doesn't even have a plan. So when something happens like this, they don't even know what to do first. Maybe someone gave them an AED, which happens in a lot of smaller schools I've found with my work with Project Adam. I'll go into a school to, you know, for whatever reason, and I'll see an AED hanging on the wall, and I'll look closer at it, and I'll find out everything about it is expired. The batteries are dead, the pads are expired, and when I asked the secretary about it, she's like, oh, I don't know, you know, this parent gave it to us, donated it, we hung it on the wall, but nobody's responsible for it. So that's part of your emergency response plan, to know that somebody's going to maintain that machine if you have it. If you have that machine, it comes with a responsibility, right? So someone's got to lead the way and make sure we're taking care of that machine. And you as a student, how could you do that? If you have an AED in your building at school, you ask, who's maintaining that? You go by it and you see that it's got a red X on it or a red check mark, or it's not ready to use. You have a responsibility now, because you know, to go to your custodian, to go to your school nurse, to go to your administrator and say, hey, I don't think that AED is right. Can someone check it, right? So is there even an AED in their building? Do you know where it is? Do staff know? How are staff told where it is and educated about how to use it? Or can they use it? Somebody said the other day, you know, being scared about this kind of emergency work. It is scary if we don't know what to do. And some people think they're not allowed to touch these kinds of things that are hanging in our building. But this is considered a public access device, a PAD. We want people to take it and use it if they need it, right? If there's a cardiac emergency, we want someone to take that AED out of the case and turn it on and use it, even if they're not formally trained, because the AEDs are so smart, they'll talk right to you, okay? So are drills being held in your school? These emergency response drills, I mean, that's the toughest part for most schools, because again, staff are scared. I'm going to show you an example of a staff that went through a drill and how they responded to it. But I'll tell you, years ago, that same staff, they muddled through it and they were embarrassed because they didn't know what to do. But through education and training, we know what to do now. Okay, so that's the thing. So again, do you have a school nurse? Do you have kids in your building that are actually affected by cardiac disease, right? That they could be the kiddo that might go unresponsive. Many times we don't even know because we're healthy and we don't know. But if we do know, is that nurse creating a plan for that kiddo? And are teachers made aware of it in case they find this child on the ground unresponsive? Okay, so, all right. So right here, if we're looking at this, I think you guys have seen this already earlier this week, right? Give me a nod or a thumbs up. This is the checklist that we would use when we are starting to first have AED drills in our school. It's a very basic list. And can you tell me, yes or no, do you have a copy of this, like, in front of you or access to it, you guys? I'm not seeing anyone nodding, so can you tell me if it's in the chat, MJ?
Nothing in the chat.
Okay, so looking at this, just kind of what I wanted you to do is do some homework here while we're watching the next video. But if you don't have access to this form, that's okay. But let's just kind of look at all these yes and no's. So when we have a drill, these are all the response actions that we want people to take during a drill when we're practicing. Because just like if you were a dancer or a musician or an athlete, you would go to practice and your coach would say, this is how I want you to do it. And then what you're going to do for the next hour and a half, you're going to practice that skill, right? You're going to get it right. Because if your coach says, you stand over here on this spot, and when the ball comes, you're going to do this, or you're going to stay in the second chair for the trombones, and you're going to play this line of music, you're going to learn to do that because you want to be the best you can be at that sport, that art, whatever it is, right? Same thing for this. So here's our list of basic response actions that we want people to take. Maybe you've already learned these through your CPR training already. Hey, are you okay? Determining that the person's unresponsive. Calling for help, 911, right? Getting the team on the scene. That's from an overhead announcement at school, a page. Again, we're going to call 911. They're on their way. The team within the school that's assigned is going to arrive on the scene. They're going to start CPR. They're going to get that AED turned on and get it started. They're going to put the pads on the person, right? Put your hands on yourself where you're going to put the pads for the AED. You're going to put one on the upper right chest and right under the rib cage on your left. Okay? So upper right, lower left. All right? So that's what you're going to do. Did the staff put them on right? Yes or no? So we give them all these yes or no's during that drill to get them acclimated to what we want them to do if it was a real situation. So we're literally creating that muscle memory and that mind memory because we're practicing. And so did the AED advise us to give a shock? Yes or no? Did they put the pads on the right way or did they put them on opposite? Did they put them on wrong? So we're going to look at that. And then did we get the information that EMS needs so when they come, we have that information on the scene? And did someone go to meet them? Because our schools are locked up. Did someone go to let them in, right? Because if you have a big school, are you going to have the ambulance come to your front door and have to walk all the way through your school? No. You're going to come and have them come to the door closest to where you are for that emergency. And that door, 99% of the time, in this time of the world, is locked. So you got to make sure one of the staff members, you talk about it when you're sitting there on the scene, and you make sure someone goes to that door to let them in, okay? So did someone meet them? And did we do crowd control, right? If you were unresponsive in the classroom of your school, would you want the other 20 or 30 kids in that classroom to be sitting there watching you? No way, right? You want those kids out. And so part of your action plan at school is a teacher, a staff member, a student in that class tells everyone to get up, go to the door, leave all your books and things, and you go out and you go to another designated area that your school has decided on. Maybe you just go to the classroom next door and that teacher takes care of the class. Maybe you go to the library and the librarian takes care of the class, or maybe a secretary comes and takes you. But whatever that is, it should be in your emergency response plan at school. So things to think about. And then we go after the drill. We want to get all together and talk about it. We want to say, what did we do right? Really important to celebrate that, right? Celebrate everything you do right. Because this is not a drill to shame someone or to bully them to do something. We all want the same thing. We want to save a life. And so we want to make sure if we did it right, we want to celebrate that. What was easy to remember when you were on that scene? Was it easy to remember things because you were all talking and helping each other? Awesome. Was it easy to remember because we practiced it so many times? Or you posted a reminder on your computer screen of the things to do at your desk as a teacher? And then what could we have done better? What went wrong, right? So then what are we going to learn from? Okay. And then who was there? So we know who was there and who was learning during that drill. And who was maybe missing that was a key player in the school that we need to talk to and get them caught up, okay, and share this information with. And then, of course, our drills, we want to make sure that they are drop to shock. We want that shock within 3 minutes, right? So when we talk about our plan, 3 minutes is like the gold standard because we want to get the pads on because we know that every minute we delay care, it's a 10% less chance that person's going to survive. So if we wait 3 minutes, that's all of a sudden 30% chance that person's not going to survive. So if we go beyond 3 minutes and we haven't already shocked or started CPR or done something, not nothing, we're in trouble, right? So that's what we want to make sure. We're getting at it. We're starting quickly. We're getting that AED on if we need it. And that's that. So anyone have questions about this? Remember, the goal of your drill is to learn together as a team, to get better as a team, to evaluate what went right, what went wrong, to learn from it, to celebrate what we did right. Okay, good. And through all of that, what do? Just like when you're doing your sport, just like when you're doing your instruments, just like when you're doing anything new, you are building your confidence to do that better next time. Okay. Anyone have questions?
You're welcome.
Okay. Good. So what I want to do here is just introduce you to a couple of the tools of the trade, we're going to call them. You know, you've probably seen some of these things already, yes? Or no? Yeah? Okay.
Nope, we didn't do a demonstration of any of those yet.
Okay, well, I got one in front of me today, so let me demonstrate it for you. So this is what we call an ambu bag. This is an adult size. A lot of times they come looking like this in a plastic bag, which is unfortunate, I think. They should just come open, but they don't. They'll be kind of hanging out like this. And do you see how it looks in the picture? It looks more like a football. So you just pull on these two sides, and it looks like a football. There's a mask right here, a face mask. When we're working with a face mask like this that we call maybe a blob or something like that, it's real soft. And this pointy part goes to cover the nose, okay? Just like this. And this part will cover down to the chin, make a nice seal around that nose, mouth, and chin, so that when we do the bag, we put our hand through here, we have this down on the face, and we give our breath, right? Then we know we've made a good seal, and that air is actually going into the lungs and not just sneaking out around this mask, right? So that's your mask, your ambu bag. This is meant for an adult, someone over about 60 pounds, 65 pounds. We wouldn't want to use this on a baby because it's way too big and it would overinflate their lungs. And then what would happen? That extra air, where is it going? It's going in their belly. And what happens when we get a lot of air in our belly, guys? You might get some vomit, okay? We don't want that. So you can see in the picture here in the middle in the blue, there's different sizes. This just happens to be the adult size, but you can see there's a child size and an infant size, and there's lots of different sizes for the different size of a person, okay? You'll notice there's maybe a bag hanging off the end. Don't worry about that. That is not anything for us to worry about. It's not going to inflate, so if there's nothing wrong with it, just leave it hanging there. There's a tube here too, because when our emergency response people come in the ambulance, they're going to use this to potentially hook up to their oxygen to help give better air to this person if they need it, okay? So let that hang. Don't worry about the bag. You focus on getting your hand here and pressing this down to the face to cover the mouth and the nose, and give your breath.
Kathy?
Yep.
They're not seeing you demonstrate. They're just seeing the pictures.
Okay. How do I?
Unshare.
I thought I was up in the little. No.
Oh, I'm not sure, but yeah, unshare. There you go.
You guys see me now? I see me. Do you see me?
Yep.
All right. Sorry. Gosh, thanks for letting me know that. So here we go. Here's that ambu bag, how it comes. And we just pull it open like this. And again, nose, chin. Nice seal around the mouth and the nose and the chin. It's nice and soft, so it's going to push down and make that seal. So when we do this, the air will go into the lungs and not into the, not just leak out around the cheeks, right? And again, like I was saying, this is the adult size, lots of different sizes for different size people, okay? So here's that bag we're not going to worry about. Here's the cord that would be plugged into oxygen if we need it, okay? Questions about that, you guys? The Ambu bag. Let me show you one more thing or two more things before we move on. It's here on the floor. When we, here we go. The one little thing that you see on the screen sharing, and we'll share it again in a moment, it's like a little tube, and I always call it, it's a smoothie straw tube, right? But when you look inside of it, this one, it's missing because I use this for training. But if I were to look in the real one, it's probably this much more high. And inside here, it looks like a little white cotton ball. That's a filter. And again, if you did not have that Ambu bag, but you just had one of these and you laid it over your mannequin, let me adjust my screen just a little here. And you laid it over your mannequin's mouth and nose and you press down, you have your airway open, and you're going to give the breath. The cool thing is, because that filter is in there on this little mouthpiece, it's not going to allow, if the person vomits, it won't allow it to come back at you. So that's pretty awesome. So again, especially in these times of COVID, if we were to choose to do our breaths along with our compressions, full on CPR, we would want to use an Ambu bag. If we were to choose to use the breathing barrier like this without the Ambu bag, and we're going to use our own breath, know that that filter is there to help protect you, okay? But there are other things as well, and I'm going to start screen sharing again so you can see them. There. So you can see the little valve in the upper right of the screen. That's what I was just talking about. That would go on top of this breathing barrier. And then you can see all the little different sizes of those barriers down on the right. And then up on the center on top where that little blue square is, that's called a CPR face shield. Those are also a lot of times made by the same company that makes the Ambu bag, the picture on the left and on the bottom there, those bulby things. But this is just like a sheet of plastic. And that little circle with the red, that is just a little valve. So if you have nothing else, this works too, right? To help protect you. It's better than nothing. It's a protective equipment that's better than nothing. But could someone tell me, if you were going to give breaths and you didn't have any of these pieces of technology, what else could you use? Does someone want to unmute and tell me what they think? Like, what in your environment could you use as a barrier to do breaths? Anybody?
What was
Nobody?
the question?
Glove, Rayanne says.
A glove would work, and you just poke a hole in the glove, and that's where you would breathe into, right?
Damien
Good idea,
says
Rayanne.
tacos.
Huh?
Damien says tacos.
Well, you could use a soft shell taco, I suppose, Damien, and put a hole through it. But a soft shell taco is permeable. So people's moisture of their breath or vomit could come through that to you. So I would say, how about a plastic baggie? How about a bag from the store, from Walmart or something, those plastic grocery bags? Pop a hole through it and lay it across the face. It's not going to give you 100% protection, but it's sure going to protect you better than nothing, right? So sometimes when we're involved in an emergency response, we got to think about what's in our environment that we could use if we needed it, right? But these things are all things that you should have something like this in your school. And again, to say to your school nurse or your administrator, your principal, where are those things? If there was an emergency and I was at basketball practice, where could I get this thing to help me? Or that little key ring, those cost about $5. You could actually pick one up. ask your parents to order one for you on Amazon, so you would have one to keep on your lanyard for your school ID or something, right? So, okay, enough of that. So let's go to the next thing here. And can we bring up this video, MJ?
Yep.
This is the one from Project Adam. And it's 14 minutes, you guys. So if anyone needs to get up and stretch, now's the chance. Or if you have a question, do 5 jumping jacks or something. Yeah. So, do I need to stop sharing while you pull it up?
Okay, so which one is it?
It's the one on the bottom.
Yep.
On the left.
I will share my screen and then you can.
It says AED drill.
Okay.
All right.
AED drill.
Yep. So guys, again, it's 14 minutes. I'm gonna let it run. And then as you're going through this video, I want you to write down in the chat area
taking the time to
something that is interesting to you or you learned, okay? All right, go for it.
in your school helps to see if your plan works. It also helps to increase your communication among your staff and EMS. Drills should be performed at least 2 times each year. Today you're going to see a video broken into 3 parts. Part 1, planning your drill. Part 2, the day of the drill. And Part 3, the post-drill. Do you have a code? This code name will be used to initiate a response to a cardiac emergency by the Cardiac Emergency Response Team. The code should be communicated on the drill day and in a real cardiac emergency as defined in your communication plan. Encourage team members to be descriptive in addition to a code name and state there is a medical emergency in room blank. Include the teacher's name and geographic location. You will want to instruct your team to repeat this announcement twice to ensure rescuers hear it and are clear on location. Do you have a communication system? How will the cardiac response team know the drill has been initiated? Choose a method of mass communication to the team. For example, overhead announcements, intercoms, walkie-talkies, cell phones. Who does the drill involve? Project Adam Site Coordinator. School Cardiac Emergency Response Team. Determine if classes need to be covered during a drill or true cardiac emergency if classroom teachers are on this team. Office staff. Objective observer. To record the times on the drill summary checklist. What will you need? AED training unit. A mannequin, a cell phone or telephone, AED drill summary checklist on a clipboard with a pen, and a stopwatch. When should a drill happen? Inform your team that you will be doing a cardiac emergency response drill in the next few weeks so they have time to review their cardiac emergency response plan in advance. Do not tell them exactly when you will do the drill. It is important once the drill is underway that it is clearly communicated to all involved that this is only a drill. Where should a drill happen? Location of drills should be anywhere on campus so all staff consider what they will be looking for. Unresponsiveness and abnormal or no breathing, and what they will do. If students are on campus, be sure they are informed beforehand about what the drill may look like and that it is only a drill. The video you are about to see is a team in a school setting working through a cardiac emergency response drill.
Oh no! Annie, are you okay? Are you okay?
This is the office.
Hello, this is Mr. Lee in the choir room, and I'm going to need the E-team.
And what is the student's name?
The student's name is Annie Smith.
And their grade?
She's a 7th grader.
And what is the problem?
She is unconscious. I'm not sure if she's breathing.
All right, we'll send help.
Annie, it's gonna be okay.
E-team to the choir, room 325. E-team to the choir, room 325.
All right, everyone. Let's line up at the door over there and head to the LMC. Are you okay? Are you okay?
Any signs of life?
No signs of life. Again, compression.
For help now.
17, 18, 20.
Remove all clothing
Hey, Mary, trying to cut the shirt.
red handle to open bag.
Closest to you. There you go.
Look at pictures on pad. Do not touch patient. Evaluating heart rhythm.
Everybody back up, back up.
Stand by. Preparing to shock.
Everybody back up, we're gonna shock.
Everyone clear. Press flashing button. Shock delivered. Provide chest compressions and rescue breath.
1, 2, 3, 4.
The ambulance will be here. I'll meet them at door 18S.
18, 19, 20. 1, 2,
Continue care.
5, 6, 7, 8, 9, 30.
I got the next one, Brad.
1, 2.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 2, 3, 4, 5, 6, 7, 8, 9, 30.
1, 2.
Continue care.
3, 4, 5, 6, 7.
Everyone
9.
clear.
Back up, back up. Everybody back up.
Evaluating heart rhythm. Everyone clear. Press flashing button.
Everybody back up, shocking.
Shock delivered. Provide chest compressions and rescue breath.
1, 2.
So let's review what we just saw. The site coordinator should place a mannequin on the floor and have the AED training unit available when the real unit arrives on the scene. Switch out the training unit for this experience. Have the first person on the scene call the front office, advising them that this is only a drill. Tell them you have an unresponsive victim and give your location. Your plan now goes into effect. The school's cardiac emergency response team should be notified using the established code, for example, code blue, using the team's established communication system. The goal is to complete the AED drill in under 3 minutes, from the person falling unresponsive to the first AED shock. If this is your first AED drill, your designated observer should record a checklist summary of yes/no responses to ensure the core response standards are in place using the AED Drill Checklist 1. Once you've completed your first drill, your designated observer should record a checklist summary of responses to ensure all core response standards are met in under 3 minutes using the AED Drill Checklist 2. Both checklists are found on the Project Atom website. The site coordinator gives the first rescuer to arrive, rescuer 1, a short scenario. The AED training unit is already placed at the drill location, ready to be swapped out with the real school AED, which is brought to the scene. Never use the real AED for drills. Proceed as if this is a real cardiac arrest situation. Post-drill. Thank everyone for responding. Spend a few minutes reviewing the checklist together, noting times and duration of different steps of the response. Ask the rescuers for feedback and discuss suggestions and concerns. Celebrate what you did right. Consider whether there are any action steps needed. Were there specific communication problems? If the drill points to changes to the plan and protocol, discuss these with your cardiac emergency response team and administrator. Be sure to make the changes and communicate the changes clearly to your team. Plan another drill to test the revised plan.
Thank you so much for being part of the team here at JRG. We'd just like to talk to you a little bit about doing drills in your district. What have you learned from doing AED drills in your schools?
I think the thing that I've learned the most about doing drills is just how to react in an emergency response situation. You know, when you react in an emergency response, there's a lot of anxiety that comes along with that. And so having the opportunity to practice and practice often helps reduce that anxiety so that we know what to expect. Every situation is different, and so each time we learn something a little bit different.
And that's where our nurses do a great job training us for every situation that could occur. For example, we had a drill one time, we're out on the turf, we have to react, our AED is in a shed out there. And then also we had a situation where it was a bee sting situation, so we had to react and think quick enough and get the EpiPen, which was an awesome learning experience because we've never had a drill like that before.
I think also it gives us an opportunity to know not only what we have to do as responders, but then what we do with our students if the situation were to happen in a classroom full of kids. You know, we know how to react as an adult, and we also know what to do with the kids to try to get them out of harm's way and make sure that they're in a safe environment too, and to protect the identity of the person that's, you know, maybe going through the emergency, to help them along too.
So we have no idea whether it's a drill or a real situation. So when we hear E-team report to this room, we're acting as if it's a real situation because we honestly have no idea what we're basically walking into.
That's great. What advice might you have for other schools that haven't done a drill?
I would definitely say you need to start doing it because the more we do the drill, the more relaxed you are because you're comfortable in the situation. You've done it enough, so it's not something where, you know, obviously anxiety will kick in a little bit, but being trained and having time to practice the drills have been beneficial for our school.
Yeah, and I think each time that we do it, we get a little bit better. Our response time gets better. And like I said earlier, sometimes things happen that we don't expect. Some things, you know, go differently than expected or in the past. And so then we can talk a little bit about that and debrief afterwards and make sure that we have everything polished and ready to go for the next time.
And it's good to practice because every time you attempt a drill, your role in that situation could be different. You know, this drill, it could have been I was on the AED, she was doing the compressions. Every drill, you might be in a different role. So the more you practice it, the more comfortable you become in every single role that you could have.
And I also like the fact that our administration really supports this programming and supports our drills and makes sure that the staff that reports is up to speed and they know what to do in every situation.
And the district offers summer courses throughout the year. Our nurses do a great job. And if you wanted to get trained, they would make the time to train you in it.
Is there anything else you would like to add?
I'd just like to say that because of this training, I had a situation this summer in which I had to, in my head, I was thinking, check, call, care. I saw someone get in a moped accident. I could see the blood coming from the back of their head. And then my instinct at that motion, or at that time, was that I wanted to go care. I had my cell phone in my pocket. I knew because of these drills, they're going through my head, check, call, care. I saw what was happening. I knew my next step was to call.
Thank you so much for your involvement with the Project Adam Heart Safe School designation. I had an opportunity earlier today to watch your emergency team in action as they did a cardiac drill. From an administrator's perspective, could you tell me what you've learned from doing drills in your district and how they benefit your staff?
Yeah, that's a great question. I think, you know, one of the things we always look at in a school is creating a safe environment. And so we really look at our heart safe drills as part of that safe environment. I think it's important for us to send the message that, you know, the health and well-being of our staff and students is critical. And so we really look at our heart safe drills as part of that safe environment. I think people feel more prepared if we are drilling on a regular basis and providing time for that. I also think it sends a message that these are important things, and that even though it's not likely to happen, and we hope it doesn't happen, we need to be prepared in case it does.
All right, that's it. Thank you. All right, you guys, you want to throw something in the, can you hear me okay? Okay. Yep. Throw something in the chat box that you learned.
Helps to see if your plan works.
Oops.
It also helps doing.
We're going to play it again, I guess.
Okay. So I know we're at 1:37. Can we keep going for about 15 minutes yet?
Sure, if you want to.
I'd love to, if you guys are okay with that. I really want to bring this all home for us, okay? So guys, just stick in the chat room over here something that stuck out to you in that video. Something that you think, oh yeah, that would be important. Or maybe you had a question about, like, you didn't understand. I'm just going to peek at your chats just for a second so I see what you're writing. Damien, you're talking about the AED? You're not using the real AED? Give me a nod because I can see you. Is that what you're talking about? Yeah. So the real AED wouldn't actually go on a mannequin. It'll only go on a real person that has body heat, and so it wouldn't go. So we use a trainer so we can actually run through all the steps of what the AED can do in the drill, and we can get that real feeling of what it would be like in a real situation. So I've got a trainer here. I'm going to open it up in a couple minutes to kind of show it to you quick. So what else? I thought it was interesting. Yeah, so my school, for instance, is a huge rectangle, one of my schools, and the front of the building, we start counting. The main door is number 1. Outside of the building, it says number 1. Next door over, number 2, number 3, number 4, as you go around, all the way to the other side to door number 19. Also, though, we add a letter right after that. So the front of my building is north, and then the back of it is south. So the door number 1 is 1N for north. So it's on the north side of the building. So when I get around to the back and the door number 8 is back there, it'll say 8S for south, okay? And also east and west. So whatever number the door is followed by the letter of the direction it's pointing. So when EMS comes, they know exactly where they're going. They can look on Google Maps. They can say, this is east. That door I'm going to is on the east side of the building, and there it is. So, okay. All right. Good. Well, let me continue to screen share, and we'll get through the rest of these couple slides I've got, okay? Thank you guys so much for your comments there and your input. Awesome. So I'm going to move this little thing out of the way here. All right, we already talked about this, so we're going to keep moving forward. One thing I will say is this video, again, is right on the Project Adam website, the Heart Safe Schools section, and that section is divided into 4 steps. So step 1, that's your Heart Safe Schools checklist right there. Step 2, step 3, step 4. The drill videos are right beneath that, and all the other educational videos about Project Adam and about cardiac arrest and all those kinds of things. So you can go there for lots of additional resources and learning, okay? And this video is there. It's called the AED drill, and it's something you might want to share with your administrator or your school nurse if they're not aware of it. And you might also want to watch again yourself, you know? So what might COVID, how would COVID change what we do at school in these situations? So here, you know, that personal protective equipment, your PPE, that is the big talk right now in our schools. How are we going to use PPE to make everyone healthy and safe at school the best we can? So, of course, wearing your gloves, using your cloth face mask, right, to cover your nose and your mouth and not touching that thing. And if you are breathing and you're using that bamboo bag or some other kind of barrier to protect yourself, Or if you don't have a barrier, just do the hands only, the compressions. Of course, making sure we're washing our hands like crazy, especially after we provide care. And then if our clothes get soiled, that we're changing our clothes. All those things can help us during these COVID times. I think for us who are trained in these emergency responses, making sure that we're saying we can do something, not nothing, right? So once we have our team, and our team has gone through that basic checklist number 1, and they feel confident, we can move into our checklist number 2. And you can see the difference in this one. Instead of just saying yes or no, we did this, we can say we did it, and we did it within this certain timing. And when we do it within the certain timing, we know we're going to hit that under 3-minute goal of drop to shock. And so this is how we've broken it down to give the best chance to hit that 3-minute mark. We've given everything points, 1, 2, or 3 points. And then we can also give extra points for those yes and no things. Did we do CPR right? Did we put the pads on the right places? Things like that. So take the time to look at this checklist as well. And this checklist is going to tell us, did we do a good job? Did we do an excellent job? Or did we do a superior job? And wouldn't you say if this was you or your family member, you'd want them to do a superior job? And something that people say is, oh, we have barriers, we can't do it better. Or we have too many challenges, we can't do that. You know what I would say to that? I would say these are not barriers, these are opportunities. We have an opportunity as a layperson to respond to that emergency and do the superior job so that we can send someone home to their family. So always strive to be the best we can be in these situations. And of course, you know, that's all I'll say about that. But it gives us a greater chance of success, right? And then of course, this form, as well as all the other things, can be found right on the Project Adam website. So again, I can't tell you enough, use that as a resource. And of course, if you need more information, contact someone there at Project Adam or email me. This is 2 minutes. Are we ready for 2 minutes of a real video, you guys? And then we're gonna end things. We got a couple more notes to talk about, and that'll be it. But this is 2 minutes. And what I love about this is it's real. It's a real video about a real situation that happened. It's not just practice or play. I want you to see that this is a superior team that did the best they could do because they had the tools they needed. They had an AED in their school. They had staff that were trained, all that kind of jazz. So go ahead, MJ, can you pull this up? I'm gonna stop the share and you can pull up that last video.
Sure, what's the name of it?
It is, oh, can you copy and paste from the?
It's not letting me.
Okay.
I could. Let's see.
It is, you want me to tell you how to get to it on YouTube?
Sure. Mm-hmm.
YouTube.com.
Yep.
/watch ? Little V like Victor equals 1Z1 under like an underscore Z 2 1 0 U 6 C like cat.
Oh, it says no results found. Shoot. Darn.
Well, I can tell you what it was. It was a video of a girl. Can you guys still see my face?
Mm-hmm.
Okay, sorry. I'm going to put a light on here. It was a girl in her high school playing volleyball. And you guys can go to YouTube and Google it and it'll come up. It's only a 2-minute video. But it's this girl playing volleyball and she goes unresponsive. And basically they do everything right and they save her life. And she ends up talking about it with her parents on screen.
Would it be Claire's?
Yes, it's Claire. Claire is her name.
Okay. Teen's cardiac arrest caught on video?
Yes.
It's a powerful life and death drama captured
Whoops, wait a minute.
accidentally on home video. In the middle of her high school volleyball game, Claire Crawford's heart suddenly stops. They call this sudden cardiac death.
Yeah, that is so scary. Claire is a rare.
It's
Okay.
a powerful life and death drama captured accidentally on home video. In the middle of her high school volleyball game, Claire Crawford's heart suddenly stops. They call this sudden cardiac death.
Yeah, that is so scary. Claire is a rare survivor thanks to what happened next. The Fox Medical Team's Beth Gallivan is here now with more of Claire's story.
Sudden cardiac death.
Yeah, that is so scary. Claire is a rare survivor thanks to what happened next. The Fox Medical Team's Beth Gallivan is here now with more of Claire's story.
That's Anae and Tom. It is really hard for Claire and her parents to watch this video, but they're sharing it publicly to show people how important it is to get trained in CPR and to know how to use an AED. Claire had experienced shoulder pain for a couple of years, but her doctors never suspected her heart, and no one expected this.
I was like right about here, and then I staggered a couple steps.
17-year-old Claire Crawford is the girl in the video, the one whose heart suddenly stops.
Well, I felt nauseous watching it because it's a little scary.
It happened here in the gym at Loganville Christian Academy during an October volleyball match.
It was senior night.
Claire's parents, Eric and Lisa, had set up a video camera across the gym.
It was up on the stage.
You don't expect that it's going to happen at your school, right, literally right in front of you.
I had just served, and then I set the ball up, and then moved back, and then I just remember feeling like I was about to pass out.
Claire grabs her chest, then hits the floor in full cardiac arrest.
Terrified. Terrified.
The camera's still rolling. Claire is surrounded.
You're very nervous. You're not sure what to do. You're not sure what you're seeing.
Julie Sermons, a school administrator and member of Loganville Christian Academy's Code Blue team, trained in CPR by Children's Healthcare of Atlanta, sprang into action, helped by an athletic trainer and a parent who also knows CPR.
Claire had lost all signs of life. She wasn't breathing. We couldn't find a pulse.
She did not look like there was any life to her. And I, at that point, didn't know what to do.
But Julie Sermons did, because the Code Blue team had practiced this same drill at least 15 times in the last 6 years, and instinct and training kicked in.
You do the one thing that you know to do, and then you do the next thing, and then you do the next thing. Have someone call 911. Go grab the AED.
That AED was only about 30 feet away.
Lots of praying. Lots of panic and praying.
You hear a lot of noise. The machine is constantly telling you what to do. It was telling her to shock. Which Julie and I kind of looked at each other, and then she pushed it.
And just like that, 4.5 minutes after they lost Claire, they get her back.
I woke up to one of the ladies in my face that had been giving me mouth to mouth, and the AED machine was like shouting CPR, CPR, and the alarm was going off.
Claire's heart, which tests later revealed had 3 severe blockages, had slipped into a fatal irregular rhythm known as ventricular fibrillation, or VFib.
And it's a rhythm that can only be corrected by a shock, so if I'd gone down and they hadn't had the AED, CPR would not have been enough to bring me back. I would have had to wait for the ambulance.
Walton County EMS got there quickly in about 11 minutes. By that time, Claire was already sitting up and talking. She underwent a triple bypass, then surgery to put in an internal defibrillator.
I was just blessed to be in a place where it could be treated. So 2 weeks before that, I was in Honduras on a mountain, and there's no way if it had happened then, I would have lived. So.
And this week, Children's Healthcare of Atlanta shared the video of Claire's AED save on its Facebook page. In the first 2 days, it's been viewed 7 million times.
One of the comments that sticks out are, why would any school not have one of these?
And Loganville Christian has 3
so that's that.
stationary AEDs and 2 travel ones that go with their sports teams. They were all paid for with grants. Children's Healthcare of Atlanta's Project Save trains schools in how to respond to emergencies just like this one. And on Friday, Project Save is holding a drill day. They're asking schools to practice their emergency action plans so that they know what to do just in case. Because Tom and Sinead, this was
MJ, you can stop that one.
Everything was carefully coordinated. They had the AED, they had the training, they knew what to do. They'd practiced it enough that when it happened, it was like rote.
Everybody
They just
jumped
did what
into
they
action.
knew to do.
Yeah. It's a reminder to all of us to practice and, you know, make sure that it's
Also to look
front of
around.
mind.
Where is the AED
Right.
around me at the gym? Where is it at school? Ask.
More so for high schools, Beth, than like elementary and middle schools?
Well, they're training all schools, and they're trying to build teams of administrators in their schools and teachers who, like 5 to 10 people who can respond when they have a drill like this, because seconds matter, minutes matter.
Sure
You know,
they
you've
do.
got to respond quickly.
Yeah. Glad they did in that case.
Absolutely.
Thanks, Beth.
All right. Good. All right, I'm going to share my last couple slides, you guys, and we will be out of here. All right. There. So when we look at this last, one of these last slides, I will say again, here is what it looks like when you're looking at the Project Adam website, if you haven't looked already. And you can see right here where it says step 1, Heart Safe School Checklist. And right under it in red, if you were to hover over that Heart Safe School Checklist, it'll come right up. You just click on it and the form will come right up. So it's something that you could actually print now and start checking off the things that you know are already done in your school. And you might be surprised that your school has no clue that Project Adam exists. You might be surprised that your school has this already in place. And then it's just a matter of going to that school nurse and going to that administrator and saying, can I be part of this team? If I hear that code call at school, can I get up and leave my class and go help? You know, will staff be made aware that I'm trained and I can help? We actually had a 5th grade boy, so someone younger than you even, Damien, that we had run one of our drills in his school a couple years ago, and he was in that classroom. And when we did crowd control and we asked all the kids to leave, he stayed. He put his feet in firm and he said, I'm a Boy Scout. I know how to do CPR and I learned how to use an AED. Can I stay and help? Now, it was a drill and we had a mannequin on the floor, but this kid was so excited that he knew what to do. And I can tell you what, this 5th grade boy, he did a better job than the teachers responding to this drill emergency, because he had just had that training recently. He was very excited about it. And I was just like, wow, we need to change our thinking as adults to say, these kids that are being trained through their, you know, Boy Scouts, Girl Scouts, wherever you're getting the opportunity, you need to be part of this team, you know, because you're go-getters. You're not going to second guess yourself like an adult does sometimes. You're going to do what you've been taught to do and not, you know, not think about it, which is awesome. Okay, so Heart Safe Schools, get that checklist, go to it, ask to meet with your administrator or your school nurse. And, you know, in this time of COVID, they are very, very busy trying to figure out how to get you all back to school if you're going back to school this fall, virtually or in person. So don't be surprised if they put you off a little bit because they're busy right now, but do keep knocking on their door and be patient and ask for them to meet with you so that you know that these things are in place in your school. And that's what I'll say about that right now, okay? But again,
and guys,
yeah.
with the Heart Safe School checklist, that was included in the invite this week and in the agenda. There's the link in there in your Zoom invite.
Perfect, good. These are 3 AEDs that I thought I would just show you quick, and I have them up in my room, and I just think we've run over a lot of time, so I'm not gonna show them to you, and I hope that's okay, and you have another opportunity to see them or ask again your nurse or whoever's doing the training in your building if they can show you the AED and how it works. But really, look and see what kind of AED is in your building. These 3 are pretty much the most popular ones. There's the red Phillips, the yellow is called a Life Pack, the green one is called a Zoll. You can see that they all have different looking pads, but truly the machines do the same thing. They're just different companies that make them. The white case on the end is literally the case that it typically is in, or maybe a little horseshoe shelf that it sits in. But these white cases, when you open it up, an alarm will sound, and don't be surprised, it's very high frequency, but it's to do a shout out to people in the community where they can see you in the school or hear it in that area that, hey, somebody needs help, right? Because there's an alarm going. Now that alarm box is typically not wired to a phone, or it doesn't automatically call 911, so you still have to call 911, okay? So make sure we still call 911 and let them know we have an emergency, okay? Again, whew, we covered a lot in the last hour and a half. So I appreciate all your patience and your comments and everything. So any last comments, questions, anything before we end today? I can't see the comments right now, so unmute yourself and go ahead and ask.
Damien says hashtag Boy Scouts, and he's going to email his school counselor.
Nice.
And a lot of stuff he didn't know, and thanks for teaching us.
Good, good.
Yeah.
The last thing I put up here is just a challenge for you guys. I don't know how long you're going yet with camp, but this would be a really great challenge, is to get yourself to that Heart Safe Schools site, look at those 4 steps, and just looking at it, go out of each step to Heart Safe Schools designation. What's one thing that you learned in that area that you didn't know? Or one thing that you think, whoa, I really got to talk to my counselor or my nurse or my principal or something about this, okay? And I just think we all agree that this program is pretty important for all of our schools, for the safety and health of our students, our staff, and our community members that use our schools. Probably like Kim's group, you know, you probably have a group that comes into schools maybe, or Boy Scouts that are using the schools after hours, athletes, things like that. And that outcome for staff is, you know, and students and those community visitors are, we could potentially save a life. That is priceless. So I'm going to leave you with this real quick. It's just thank you for this opportunity to be with you. I love what I do, and I just think it's an amazing opportunity for me to be able to talk to you about something that's so important to me. I just want you to remember that the world needs every one of us. So stand up. Don't be afraid to lead. Be the best you can. Don't leave. Be the best version of yourself, right? And Project Adam has a Facebook page. They also have a monthly newsletter. So if you want to subscribe to either one of those, go for it. And that's it. If you want to jot in that chat box before you take off, what did you learn today? That would be awesome. And if you have questions for me, my email's there. So please feel free to email me, okay? Good. You guys have a great rest of camp. I wish we could all be there together. Peace out.
Yeah, thank you so much.
You're welcome.
Kathy. And Ready Camp goes until the end of the month. So, but we are going to try to continue throughout the year, the school year too, and offering education for those who are interested in it. So anyway, thank you so much for providing this information, and thanks for all your support of the youth in your area. That's awesome.
Well, I love them like they're my own. So it drives them nuts sometimes, but I'm relentless.
Great. So awesome.
Well, thanks everybody. Have a terrific rest of the day.
Thank you. Kim, do you have anything to add for tomorrow?
Nope, just tomorrow is CAP, the Herma Heart Center's CAP lab presentation. So that should be very interesting, and we'll see everybody tomorrow.
Sounds good. Thank you.
Thank you.